Really happy to have you here with the DVHIMSS team.
I'm so happy to be here. I've been so warmly welcomed into DVHIMSS in just the past month, and it's been wonderful. I really appreciate you inviting me on to talk.
Yeah, thanks. We're really happy to have you here. And as part of the little icebreaker, we just like to get to know our members. So if you could tell us where you're from, how long have you been in this area?
Yeah, this is a great way of doing it too, because new members. I think one of the biggest challenges isn't always just for new members meeting everyone, but it's also everyone figuring out who the new members are. So this is a smart way of doing this. I was born in Maine, near Kitty National Park, Bar Harbor, Ellsworth area. Lived there 10 years, so I was about, entering in my teens and moved down to North Carolina. My parents moved down to Raleigh. So I lived in Raleigh for a while, went out to school in Charlotte for a little bit. Then I married my wife, who's from upstate New York, and so then I moved here to Philly. I've been here in Philly about probably going on 4 or 5 years now, while working for Jefferson. It's been great.
Awesome. Welcome. We definitely want to get to your hidden gem later on. How long have you been either a HIMSS member or interested in HIMSS? What interests you about being a participant here?
Yeah, so I think it was a big change coming from the health system side and population health to the JHP side. I think also kind of going from, an entry level role to more of a mid-level senior individual contributor role. And so I was actually for the first time really exposed to a variety of vendors. So in pop health, it's pretty much just Epic. And Epic's an industry incumbent, and so there's not really a lot of choices going on with Epic, but on the payer side, there's all kinds of vendors we're using all the time. We're using MHK Prominence, HRP. We're thinking of Epic Payer. We're using Salesforce. We're using Evicourse. There's so many vendors. And my boss said to me, he was sending me to a conference, and he said, if you see any cool vendors there, especially in the tech area, let me know. And there are all kinds of cool vendors there, of course. And so I realized that I needed to get a little bit more domain knowledge on the IT end. I also really needed to build a bit more of a network of people involved in informatics so I could bounce ideas off them and, not be so kind of ignorant about the field. And so one of my New Year's resolutions was get more involved, network more. And DV was a really great opportunity that came across my radar. And so far, I've already learned quite a bit. So it's been really good.
That's awesome. I think for me, as someone who's a clinical informaticist who comes from the nursing world, like worked in the operating room, did data business management, now working in the outpatient informatics world. It's still primarily Epic, but then when I talk with my finance colleagues and operational colleagues, and again, just talking with different vendors who are providing service for us and with us, it's amazing to see. And yeah, I will validate that when I went to the fall conference, just the plethora of vendors that fall under this category is amazing. And so I'm in total agreement. I think that this has been a great eye-opening experience to get myself out of just the Epic world and into seeing what the rest of IT has. Yeah, you mentioned you're growing in your career, you're working for JHP. Maybe you could tell us a little bit about your schooling background. How did you get to where you are, and kind of what exactly are you working on these days?
Oh yeah, no, thank you. And it's been great to meet, I mean, you have met before kind of during this journey, and that's really been a big part of the journey is meeting people. Started off as a pre-medical student, I was considering computer engineering and nursing, and so I did pre-med and biology and public health, finished my degree at Jefferson with a bachelor's in health services management. I moved out right when I was 18, working full time, going to school full time. My parents, of course, very generous, helped support me through the first 2 years of college. And then after that, I was on my own. And so figured out medical assisting was a great route to get, above minimum wage and also job security. And so I started working in Philly as a medical assistant at Jefferson Neurology, worked up there, started off, $15 an hour, kind of living in a basement apartment here in Philly. Moved up a little bit there. They had some raises come through, and then I was given the chance when I finished my degree to work in pop health. So started working in enterprise pop health, which that was a big transformation for me because I went from, working under the medical group to kind of working with executives. I'd met Bali Yahia when he first started, Dr. Yahia. I had met the SVP of pop health, Rebecca Adkins. And so I was like getting this exposure to these executives, which that was really transformational for me. Decided to pursue an MBA also at Jefferson. And then that's when my mentor had said, you could get a lot of value moving over to the insurance side, always look for those opportunities. And so through networking, an opportunity developed and came about. And so now I've been with the health plan for a year. My main focus and our team's main focus is Medicare Stars. For me specifically, that's really talking about CAHPS, so member perception. Is the healthcare quality good according to the member? Are they able to schedule an appointment time according to the member? The data is great. We love looking at the data, but the perception of the members is sometimes very different. We can have great appointment times for one specialty, and then when it comes to dental or hearing, it's bad, and the member isn't going to really distinguish those two things, of course. And so that's what we're working on there. Recently applied for a PhD in population health for healthcare quality, also at Jefferson. Hopefully I'll hear word back on that soon. But yeah, I'm kind of, getting education and really trying to learn as much as I can a year in, and I'm still soaking up information. Probably a little bit more effective now than I was when I started, but I'm still not as effective as I was in my past role. I think that just goes to show the complexity of insurance, way more complex than what I think I was prepared for. So it's been a good couple of years.
Yeah, I think that's amazing. I think as someone, I think why, I like to stay in touch and follow what you're doing. And I think the value that you bring to the group is that we have such a wide variety, and insurance is something that's puzzling to me. It's
Yeah.
certainly in my role now working in the outpatient realm, it certainly has it hits you at the front door a little bit
Yeah.
more to care versus when I was in the operating room. We never had to worry about that because patients were here for service. The hospital kind of worries a lot about that stuff on the back end. But certainly that's a real thing, right? Like payers are a real part of our reality. And I think the more that we learn about how they work, and I think, the more that they can help us at least get to talking about quality and like rewarding quality, I think that part of that as I grow in my career is just learning about incentives, right? And so we should
Yeah.
be incentivized to do the right thing. And, the reality is that a lot of it is talked with dollars, it's talked with ratings, it's tied back to reimbursement. And so it's interesting the more I learn about it, how much it has an effect and how much it can change how we operate. And so I think to have you in the group and to network is great. Tell me, look, because I know outside of that also you are running, helping to run, and you'll clarify for me. You have a very important part, very big part in the American Journal of Healthcare Strategy that you're involved with. If you can tell us more about that, because I've certainly enjoyed following the content on LinkedIn and YouTube, and I want everybody to get a chance to hear you talk about that.
Yeah, thanks, Mark. That's so kind of you. I always I'm always surprised how many people follow it, and also like the levels and the roles. I mean, you have such a special role with what you do, and so it's an honor for me that you follow what I do. So the journal was really started. Saeed Siddiqui, he's an administrator in facial plastics. We kind of join organizations strategically. So he's part of organizations I'm not a part of, and I'm part of the ones that he's not a part of. We try to really get a good network going. And so he's on facial plastics administrator at Jefferson. And so, we met each other on LinkedIn, I think, and he wanted me to, do some writing for him, and things just really took off. Investors came in. We had a board of kind of directors who really guided us tremendously to the point where we were able to get clients, looking at, okay, six figures. Okay, how in 2026 can we get to 500,000? So, that's been a great educational experience for me with revenue and finance. I think on the personal side, the biggest thing is that we're able to really impact people, especially students. So healthcare administration has existed for a long time, but it still is very early when you compare it to nursing, and even earlier when you compare it to kind of physicians. And so there is not this training and certification and education in the healthcare administration world that you find in nursing, medicine, or even business. There's so many business schools and business journals out there that carry so much weight and prestige, have so much education, and it just hasn't developed as much in healthcare administration. You're still starting to see new MHA programs popping up even now. And so one of the biggest things is trying to educate and empower people to get an MHA at, a CAMI accredited program, to get a fellowship at a good, institution, and then go on to practice as an administrator in a really ethical and strategic way. Another part of it is encouraging competition. I want big systems, government, small, single family owned businesses. They all need to compete in my mind for us patients to be, given the best quality for the lowest price. And so if we could train people how to think strategically, get people talking and communicating, go from a spirit of kind of competition to collaborative competition. That's what I really am trying to do. And so we've grown from, a couple thousand followers to nearing, 6,500 right now. We went from, one or two clients to five or six clients who do advertising with us, started, covering just students. And now we have a students dedicated podcast and an executive podcast. And Zach came on board and recently launched a physician and nurse leader dedicated podcast. So the growth has been tremendous, but I owe it all to the team. Almost none of the journal stuff is my idea. I just execute on it. I'm the president and COO, so my focus is really on execution and getting things done. And it's been incredible. The support we've received from the community, organizations like this, we're always being able to get involved with, and it's been awesome.
Yeah, no, that's great. It's great to hear, an awesome starter story, local, homegrown, really being able to see you guys leverage a niche in the market that hasn't been really tapped into. And I was talking with my office mate. She's one of our senior performance excellence managers, and she comes from, I would say maybe you would say like a classic health administration background, like knew she wanted to be in health administration, knew that she was not necessarily a clinical person, but knew that she wanted to make an impact. And so she had gone through, the formal schooling. She was also at Jefferson. She has her MHA, and we were both talking about how she's seeing on the clinician side a lot of dually enrolled and dual degree physicians with MD MHA, because there's this emergence of respect for the role, and that clinicians want to get into it and they want to leverage their clinical skills, but also learn about how to navigate the administrative part that we don't learn in nursing school or in medical school, to my knowledge. And so there is this respect, because as clinicians, we want to have an impact on our patients, and a lot of it comes from, not just providing the service, but being able to like administer and stand up clinics and understand insurance. And so that's where the MHA is coming into play a lot more. And that's where I think your guys' journal is coming in as a, outside resource to really boost up, the content that's out there, the value that's out there. And so it's been really exciting. I think we talked a year ago just to see the growth that's happened. And, I'm so excited for you guys.
I appreciate it so much, Mark. I mean, and the thing is, from my perspective, is clinician leaders like yourself. I have, in a way, a lot of envy of your clinical training, because there's a lot of things I do not and am not able to understand, and also a tremendous amount of respect that comes from the clinician as well, having that clinical background, actually having taken care of patients. So we need that collaboration where, like you and me having networked and talked, where we can get together and talk about problems from your clinician background and your leadership background. It's so important. So yeah, celebrating clinician leaders is kind of one of our top priorities this year at the Journal. So yeah, I appreciate you saying that and following everything. I really appreciate it a lot.
Yeah, and for everybody here watching and listening, we'll have all the links down below. And so, yeah, I've got a couple minutes left here. I wanted to, everybody's, kind of the final icebreaker is, let's talk about what's your favorite hidden gem in the Delaware Valley. It could be best place to eat, some like a sleeper cheesesteak spot, a cool relaxation place. Give us your hidden
That's tough.
gem.
Uh, so for context, I am probably not the best explorer. I sold my car when I moved to Philly, and I've stayed mostly in Center City area, traveled around a little bit, but I will say, I haven't really liked Pat's or Geno's cheesesteak. I'll say that Cleaver's to me, my wife does not like it. My friends do not particularly care for it, but something about Cleaver's for me, they have a lot of buy one, get one cheesesteaks. So you get two, huge cheesesteaks to last you five, throughout the 5-day work week. So I'd say if you haven't gone to Cleaver's yet, whether it's chicken or beef, gotta love Cleaver's. Another one that to me is a big hidden gem is Baz's. They're open all the time, and they are halal cart chicken, and they actually make chicken tenders out of the halal cart chicken. So it's really good because it has that spiciness to it. So yeah, I'm a big food guy. I love food. If you're in Philly, gotta stop at Cleaver's. You gotta go to Baz's. My dad was bringing a Cleaver's cheesesteak through TSA back to North Carolina and had it like saran wrapped and tinfoil wrapped to keep the smell out of the plane. But they thought it was like a bomb or some like weird substance in the tinfoil. So they were like opening at the TSA Philly airport, opening up like a Philly cheesesteak on the way back. So that was a great Philly experience for them. So I always going to recommend Cleaver's or Baz's.
That's amazing. I mean, you got to just eat it then and there, right? Or share,
Yeah,
I
pretty
guess.
much. Give it to the TSA guy.
That's
Yeah.
awesome. Oh man, that is probably the most Philly airport story I've heard in a long time.
And it smells up the whole TSA line because it's you got your onion and your, mushroom on
Whole
there.
plane's hungry.
Yeah.
That's awesome, man. Well, listen, Cole, thank you for the time. I appreciate connecting as always. We'll have your contact information down below. I know you're on LinkedIn. Any other place that people should reach out to get in touch with you?
Yeah, please, anyone reach out to me, no matter what it's for. Always happy to meet. And it's CLYONS at ajhcs.org. I check that email. My assistant checks it as well. So it's the best way to get a hold of me is there or LinkedIn. Whether it's, looking for a job recommendation, anything, please let me know. Love meeting people. So yeah, please reach out.
Awesome. All right. That's great, man. Listen, it's been great to reconnect and
Oh
connect and
yeah.
catch up. I'm so excited to have you featured here on the member spotlight, and look forward to future engagement with the journal and with DVHIMSS.
Oh, likewise. Yeah. Thanks, Mark. I really appreciate it.
Yeah, man. Have a good one. Take care.
Oh, you too. You too.
All right, bye.